Hi everyone, my name is Marielle Contesse and I am a principal research scientist at Emmes Endpoint Solutions. Today I'm going to be talking to you about the Mitochondrial Video Assessment Study. I'm going to first start off by talking to you about the rationale behind the development of the Mitochondrial Video Assessment, and then go into how it was adapted from the Duchenne Video Assessment, and then I'll go into the details of the study. So there are some gaps in current Mito outcome measures that this video assessment attempts to address. So we have some measurement challenges in capturing functional data in a clinic setting. So daily function for individuals with PMM and POLG can vary based on levels of activity, such as travel. So if a participant has to travel across the country for a clinic visit, that may impact their performance on an outcome measure the following morning. We feel that it's important to measure typical function when assessing clinical benefit. Additionally, a lot of existing outcome measures are not measuring what's meaningful to patients. The 6-minute walk test is currently used as a primary endpoint in many of these clinical trials for PMM and POLG, and it's a submaximal exercise test designed to assess endurance, walking capacity, cardiopulmonary function, and aerobic capacity. And while this test might measure how fast a participant is walking, it's not necessarily measuring how difficult it is for them to walk. And that might be what's more meaningful to patients. Additionally, it's not looking at how difficult it is for this participant to perform other activities of daily living. Mito patients also describe being able to get through a 6-minute walk test, but having a significant recovery period following it, which this assessment is not able to capture. So our solution is a new approach focusing on measuring ease of movement. Our tool assesses patients in their home environment after a typical amount of daily activity, performing movement tasks that are meaningful to daily life. It measures the way that the individual performs the activity rather than how fast they're doing it. By measuring the number or severity of compensated movements, we have the potential to detect incremental yet still clinically meaningful functional changes. So this kind of all started with the Duchenne video assessment. The founders of our company are caregivers of individuals with Duchenne muscular dystrophy. And this started nearly a decade ago with the very early development of this outcome measure, going into the more formal development period where we selected the movement tasks to be included in this assessment, developed a scoring system where physical therapists would use to score it, and then also how a statistical team would derive an endpoint from all of this data. We've gone through validation work, tested reliability. We've tested the ability of this outcome measure to detect change. It's currently in FDA's clinical outcome assessment qualification pathway, where it would be, if it's qualified, it would be able to be for use as a primary endpoint in clinical trials. And it's currently in clinical trials as an exploratory outcome measure right now. So the way that the Duchenne video assessment works is caregivers and participants download a study mobile application. They receive study supplies at home, and they receive training. So they are able to read a training manual and watch training videos with examples of individuals performing the various movement activities. And this training teaches them how to set up for each movement task, the instructions that the caregiver is going to provide to the participant. It kind of standardizes all things like lighting, clothing to make each video comparable to previous time points. Caregivers then video record participants performing the movement tasks within the mobile app in their home environment. So for the Duchenne video assessment, we assign movement tasks based on the participant's functional group that they branch into at enrollment. And so ambulatory participants have tasks such as climbing 5 stairs, standing up from sitting on the floor, standing up from sitting on a couch. Our non-ambulatory participants are assigned activities such as taking off a t-shirt and putting it back on, eating 10 bites of food, putting their arms back onto the armrest of a wheelchair, things like that. Once the videos are submitted, data monitors review the video quality, and they have the potential to request video reshoots if they deem that the videos are not scoreable by physical therapists. So if the videos don't meet the criteria, then caregivers are asked to re-record them so that they can be approved for scoring. Physical therapists are certified in scoring of Duchenne video assessment. videos, and they score the videos using an online scoring dashboard where they complete the scorecards within the dashboard. And each scorecard has pre-specified compensatory movement criteria. And I will show you an example of that on the next slide. And then our statistical team derives the endpoints and analyzes the data. So this is an example of an individual with Duchenne muscular dystrophy doing the stand up from sitting on the floor tasks. I'll show you that first. And so the training materials described to this caregiver and participant, kind of the distance that the caregiver is going to stand from the participant while they're filming the activity, the setup, the starting position for the participant, the instructions that the caregiver is going to say before the activity, all that is standardized so that it's the same at each time point. And then on the right-hand side of the screen, you can see the scorecard. So this is what the physical therapist is going to be using to score this activity. So the first criteria on every scorecard is the ability to perform the task. So the physical therapist determines, can this participant stand up from sitting on the floor without using furniture? And as you can see, this participant is able to perform the task. So they'd be scored as an A0 for this. If the participant was unable to perform the movement activity, they are assigned the maximum number of severity points for that activity, and then the physical therapist doesn't score down the rest of the card. So I'll walk through the scoring of this particular one. So as you can see, the participant is on all fours with a base of support markedly wider than shoulder width. So they would receive a B3. The participant walks both hands towards the body along the floor from a Gowers position before lifting the trunk. So he would receive a C1. He uses one hand to push off his thigh. So he would receive a D1. And he's not straining to lift the trunk in any of the following ways. So he's not arching his back, throwing his chest out, using neck or head for momentum. So he would receive as an E0. So the total number of severity points that he receives for this particular activity is a 5 out of 8. So 63% severity for this particular task. So as I mentioned before, we've done a lot of work on the development and the validation of the Duchenne video assessment, and all of that is available in the published literature. And so I'm not going to get too much into this in this presentation, but wanted to provide that background before we go into how we've adapted this existing assessment for mitochondrial population. So to start off with this adaptation, we wanted to make sure that the movement tasks that were selected were going to be relevant to the PMM and POLG populations and would be complex enough that they'd be sensitive to incremental changes over a short duration of time. So we conducted interviews with patients, caregivers and partners, and clinicians to select the movement tasks for the activity. And this is the list, the final list that was used for the study. So we have sit up from lying in bed, shampooing hair, putting a shirt on and taking it off, cutting and eating food, drinking water, lifting a gallon container, walking, standing from sitting on the floor, reaching across a table for a cell phone, standing from a chair, and climbing 5 stairs. So those are the standardized activities. And so those are the activities that will have scorecards for each of them that have the compensated movements that a participant might use to compensate for muscle weakness. And then there's an optional participant choice activity. So we use the participant choice activity as kind of a more personalized activity, something that the participant's really struggling with prior to baseline. So the participant would select this activity before their baseline capture, and it's usually something that's right on the edge of their function. And this is often the activity that's going to be the most sensitive to change during a clinical trial because it's something that is right on the edge of their function at baseline. So they select that activity at baseline, and then they perform the same activity throughout the study. And the physical therapist would score change from baseline, looking at both videos, score an impression of change rather than having a standardized scorecard for that particular choice activity. So I'm going to go into the Mitochondrial Video Assessment Study. So after we had all these tasks, we needed to collect some video data to be able to see how it looked when participants were performing these activities and what types of criteria we would need to add to a scorecard. So the objective of the study was to collect that video data of individuals with PMM and POLG performing these activities. So for this study, we enrolled 10 individuals diagnosed with POLG who were at least 16 years old, and 19 individuals diagnosed with PMM who were aged at least 16 years old. Our funders and collaborators on this project were Mito Australia, the POLG Foundation, and UMDF. So at each time point, participants completed the remote video assessment. So all of those tasks that I showed you a couple of slides ago. And in addition, they completed a questionnaire, and that questionnaire asked them about any factors that might have impacted their performance on the videos. So, were they sick? Were there any things that might have impacted their energy levels? Really to get a sense of what might impact any changes in performance that we might see throughout the course of a day or from day to day. We also asked them about their impression of their functional ability at that time of the video capture. And then participants were asked to collect this data at 4 time points. So most of these participants were enrolled at the UMDF annual meeting. So they collected their baseline set of videos at that meeting. And then they were asked to do the rest of the captures in their home environment. So they were asked to do these 2 weeks later, both a morning and an evening capture, so we could take a look at any variability within the course of a day and how the participants performing these activities. And then they were asked to do another AM capture a week later, so we could take a look at any variability within the course of a week during the same time of day in the morning. So we're currently in the analysis phase of this. So this started in August, and the plan is to complete this by the end of the year. And we have a physical therapist who's reviewing all the videos, developing new scorecards for tasks that were not included in the Duchenne video assessment, and adapting the Duchenne video assessment scorecards for tasks that were part of that assessment. We're also taking a look at whether we'll need separate sets of scorecards for POLG and PMM populations, or if one set of scorecards can be used for both populations. So that analysis is going on right now. So the mitochondrial video assessment has the potential to expand access to clinical trials by eliminating the need to travel to clinical sites. Additionally, it reduces travel-associated fatigue that might be impacting study results if participants can collect the data from their home environment after a typical amount of activity. In addition to use in clinical trials, there are opportunities for telehealth using this assessment and tracking function in the home environment, where instead of having to fly across the country to see a specialist, you might be able to submit your video data from different time points to look at changes in function over the course of time in the home environment. We are grateful to the Mitochondrial Video Assessment Study participants who made this research possible. The study was funded by Mito Australia, UMDF, and the POLG Foundation. Thank you so much for your time. If you have any questions at all, please feel free to send me an email. My email is in the bottom left-hand corner of the screen, mcontesse@emmes.com. Thank you again for your time.